So I'd like to welcome everyone to this very exciting session, Secure Wash, Promote One, in parentheses, Health. I welcome all of you on behalf of the conveners to this session who you see here at the bottom, the German WASH Network and the German Network Against Neglected Tropical Diseases, with their partners DAHW, CBM, VSF, and SuSanA. And it's a great pleasure to have all of you here. Thank you for joining. Next, please. Can someone please help switch? Perfect, thank you. The first thing I would like to make everyone aware is, if you're joining in this call, that this session will be recorded. I think it's to the benefit of everyone attending that you can later see this recording, but at the same time you must be aware of the fact that is going on, of course, and so if you do not approve of that, please do leave the session at this point. But of course, I'm hoping that most of you will stay. In terms of bandwidth, we know some people are having challenges with that, so I think it's good to say that we all keep our cameras turned off. We don't want background noise, so please keep yourself muted. And of course, when people do speak, we're happy to have cameras and microphones then, of course, turned on, because that would be helpful. The agenda of what we're aiming to do, what can you expect? We want to talk about what role does WASH play from a health perspective, with a focus on neglected tropical diseases. We will have a keynote on this issue, and then insights on practical experience from 3 professionals from NGOs. And then we look forward to hearing from you. We would like to have a discussion and take the discussion in the direction that you want to take it in. Then with closing remarks with a colleague from BMZ. I'll introduce the speakers later. So without further ado, let's go over to our keynote speaker. My name, by the way, is Thilo Panzerbieder. Sorry, I didn't introduce myself. I'm the chair of the German WASH Network, which is comprised of 25 NGOs in Germany, German NGOs working abroad in the world in the field of WASH. And it's my welcome to lead you through this presentation, these presentations and discussion today, but you want to hear me speak as little as possible, so that's why I hand over immediately to Dr. Anthony Solomon, medical officer in the Department of Control of Neglected Tropical Diseases at the World Health Organization. And Anthony, I would like you to turn on your camera and your microphone, and the floor is yours. We look forward to hearing from you.
Thank you very much, Thilo. Morning, everybody. I'm Anthony Solomon. I'm an infectious disease physician, serving as chief scientist to the Department of Control of Neglected Tropical Diseases at WHO. I'm really honoured to be giving this talk on behalf of 2 WHO departments, the NTD department and the Department of Environment, Climate Change and Health, where Dr. Sophie Boisson in the WASH unit spearheads the WASH side of what's been a very strong interdepartmental collaboration. And collaboration, I guess, between WASH and NTDs at a broader level is what I'm hoping to help foster more of today. Next slide, please. Thanks. The NTDs are a group of mostly infectious diseases that have difficult to master names. They're neglected because historically they've received less attention than is warranted by their contribution to human suffering, and they're tropical because the tropical parts of the world are generally the places where the poorest people live, and these diseases are both caused by and contribute to poverty. Poor people also generally have much worse access to WASH than richer people, as you know, and for some of the NTDs, WASH is very important in one of several ways. I'll illustrate that point now with 3 of the 20 NTDs, and will involve a couple of pictures like this one of disease, in case you want to look away. So this is dracunculiasis, also known as guinea worm disease, and people are infected by drinking water containing tiny crustaceans that are infected with the larval worm. Filtering water before you drink it prevents infection, and that simple measure, combined with case containment and water treatment, has reduced the global number of new cases per year from 852,000 in 1989 to 54 in 2019, 48 of which were in one country. But clean water is essential to eradicating this disease, trichomoniasis. Next slide, please. Trachoma is a painful eye disease. The eye that hopefully you're about to see if the slide flicks over is blind because it's had conjunctivitis with a particular bacterial strain at least 150 times, because the man that owns it is poor and has terrible access to water and sanitation. Communities that get trachoma are places where people practice open defecation, because if you could go to the next slide, the young lady shown there is the fly vector for trachoma, and she lays her eggs only on human feces that have been left exposed on the soil. Just as for guinea worm disease, we've come a long way towards winning the fight against trachoma over the last 20-30 years, with a number of people needing interventions against trachoma falling from 1.5 billion in 2002 to 137 million in May of this year. Next slide, please. Snakebite envenoming is illustrated there. It's an NTD as well. I haven't got a graphic picture to show you of a critically ill child or of the long-term consequences of tissue loss due to snakebite, but I will note that people without good close access to wash walk further to get water and to go to the toilet, often in the dark, and are at substantially higher risk of being bitten. Water is also essential to care for people with this and other NTDs, but as you know, 1 in 4 healthcare facilities in the world lacks basic water services. Next slide, please. WHO has long recommended WASH as one of 5 interventions against NTDs. But as recently as 2012, when the first comprehensive roadmap for NTDs was published by WHO, we were somewhat short on specifics, just saying that statistics show that the situation was bad on WASH, and until that improves, it'll be hard to sort out NTDs. Next slide, please. But in 2015, the NTD department and the WASH department at WHO joined forces to produce a global strategy over 5 years for WASH to accelerate and sustain progress on NTDs. And it had 5 strategic objectives for better targeted joint WASH and NTD efforts. Specifically, those strategic objectives were joint awareness raising of the mutual benefits of working together, joint monitoring of inequalities, investment and progress, joint efforts to strengthen evidence for effective interventions, and joint planning, delivery and evaluation of programs. Next slide, please. In after that publication of that document, we then went on to produce a step-by-step guide on how NTD stakeholders could engage WASH stakeholders, supported by a suite of quite practical tools and resources. And this toolkit is now being implemented to varying degrees in at least 15 countries, helping to make progress against NTDs. So it's very clear, to me at least, that NTD programs need WASH partnerships. But I guess the question that's perhaps more pertinent to you is what WASH stakeholders get from working with NTD programs. And I think the answer is 3 things. If you could go to the next slide, please. First, it's an easy way to be pro-poor. We're very much trying to build those partnerships now through our new roadmap. We know that, next slide please, by working with populations affected by NTDs, you are by definition working with the most disadvantaged, economically disadvantaged people in the world. Next slide please. Second, an objective measure of the impact of your interventions is a benefit of working together. When the incidence or prevalence of NTDs falls sustainably, it's going to be due to WASH interventions, not to mass drug administration of deworming tablets, for example. And finally, a key role in one of the largest global health enterprises on the planet that has provided at least some health service for more than 1 billion people annually for the last 4 years. So we would love to work with you. Again, I'm very honoured to join this forum today, and I'd be delighted to take any questions that you have either now or electronically later on. Thank you very much, Tilo.
And thank you very much, Anthony. I wish there was some way to do a joint clap over the but we send our thanks over to you for that excellent keynote. I think it becomes very clear from what you say the importance of WASH to successfully control NTDs, and you outlined the important political frameworks that we can build on and called on people to work together to do so. So thank you for that. Very clear. As you said, in terms of, first of all, I think I want to mention there's some sort of lag, I think, in us changing the slides. So we appreciate sort of the technical challenges, I guess, that this brings with it. But this is a perfect segue to our first of three panelists now. And I would, as Anthony just said, he's happy to take questions. I would like to make you all aware that I think in the chat box there was also a small comment already made about if you're having problems with your chat, how to resolve that. If there is a problem, we hope that most of you can use the chat. There's a little icon at the bottom that has a little sort of speech bubble, which is where the chat is hidden, and in this chat you are able to write things. If you want to note questions either to Anthony or either any of the upcoming speakers, you can do so by using these little @ symbols before. It makes it possible for you to direct questions and to make you aware that a colleague of ours, Jan Thilo Klimisch, will be going through those questions and choose ones later. I hope you appreciate we probably can't take all questions, but we'll choose questions that give our discussion a nice flow. So with this, I'd like to hand over to the first of our three excellent panelists. It's Constanze Bönig from Vétérinaires Sans Frontières in Germany, and I think with your coming from a family of veterinarians and working for this organization for more than 4 years, you bring an interesting perspective to our discussion. I'd be interested to hear from you, Constanze, if you want to turn on your camera, please do, and make sure you're unmuted. That from your perspective and experience, how do you consider the One Health approach adequate and to increase effectiveness in the combating of NTDs? The floor is yours, and looking forward to hearing from you. Welcome.
Thank you very much for this kind introduction, and I hope my camera is on. The screen tells me it should be.
It now is. We see you.
Okay, perfect. And well, thank you for the invitation, and it's a pleasure being here. As to your question, very briefly, because there's an interconnectedness between humans, animals, plants, and their shared environment, and it is undeniable, and that it needs recognition when approaching, when finding solutions, and because silo approaches fall short when aiming to achieve public health or even simply human health. More than half, yes, thank you for the first slide. More than half of the NTDs are zoonotic. That means they're transmissible between vertebrate animals and human. Many of them are parasites. They're food, water, or soil-borne worms mainly. 60% of all infections in humans are zoonotic, and 75% of all emerging diseases have an animal origin. And among those are Ebola or HIV, and very likely, it's not 100% confirmed, but COVID-19 is also one of those. And the One Health approach, maybe next slide, please, is an approach that recognizes this interconnectedness, as it is a collaborative, multi-sectoral approach, or transdisciplinary as well, that is aiming at optimal health and well-being outcomes, and integrates the different disciplines and sectors, so to speak: veterinary sector, human medicine, engineering, WASH, among them, but also social science, and brings it together to tackle the problems from different sides. So NTDs, we heard it before, are poverty associated and affect the poor that generally live in close proximity to animals, to nature in general, and also to their livestock, and are especially vulnerable to to infection of animal diseases. And if you only count the livestock keepers in Africa and Asia alone, it's 1 billion people. So it's not a small group. And yeah, and for this group who are poor, solutions to health need to, yeah, for them the interconnectedness or recognition of the interconnectedness is even more important, and the preventiveness of measures, where I see WASH actors coming in very much. And this multi-sectoral approach is very much recognized already, also from the WHO roadmap 2012 to 2020 already stipulate that veterinary health actors and WASH actors complement activities of human health actors in the combat of NTDs. And the new or revised roadmap even mentions or expands on this One Health approach as well. And the other the guidelines and roadmaps that we have heard about a little bit from Anthony also acknowledge this interconnectedness and the multi-sectoral approach. So generally speaking, we need to collaborate in order to sensibly work together and achieve outcomes, better outcomes in the combat of NTDs. And this concerns human health actors, animal health actors, us. For example, that's our core competencies to vaccinate and treat animals, and WASH actors. And from my point of view, I consider WASH actors, NTD actors, as their role is crucial, and I said it before, in preventing NTDs. Because, next slide please. Yeah, we have heard that before, and I think we will hear it from my colleagues who will speak after me in more detail what the different angles are where WASH actors come in. And I want to focus a little bit more of the even like additional fact that should be acknowledged when implementing WASH activities for health outcomes is the acknowledgement of animals, because they're omnipresent. They are in the kitchen, in the sheds, they are near the children playing, and you find roaming dogs where there's waste disposal sites, which increases the risk of rabies infections, because 99% of rabies in humans is coming from dog bites. So WASH interventions here for NTDs, for preventing NTDs that are transmissible directly between humans and animals, could be improving hygiene and sanitation, but not only focusing on human sanitation, but also on separating animals from living spaces of humans, and by that controlling their place of defecation. Then waste management, and by that controlling roaming dog populations, and human hygiene, personal hygiene in general, so that the infections are simply not happening between animals and humans. Next slide, please. NTDs that are waterborne or transmitted in uncontaminated or simply dirty water can be tackled by improving water access, and by that again separating access for humans, for human consumption, and access for animals, and because there again you avoid contamination, contact between human and animals that is not necessary, and improve and prevent simply infections. And last but not least, another area I want to highlight is, next slide please, food safety, where WASH and veterinary actors are at the forefront, and many NTDs are foodborne, especially animal sourced foods. And the prevention of infection is possible by capacity building in livestock husbandry and hygienic processing of meat products, through the introduction of hygienic or hygiene standards and practices, and improved controls at the point of slaughter, the knowledge of destroying offals of animals that have disease due to a disease, and in general, again, health education on food safety, also in the households for preparation of foods, etc. So there again, WASH actors are playing a crucial role and contribute to other efforts that all aim for reducing the NTD infections, controlling it, eventually eradicating it. And with that, I close, and I hope I have increased a bit of this understanding of interconnectedness and the importance of collaboration for the eradication of NTDs. Thank you very much.
Thank you, Constanze. Applause, silent applause for you. You have very much increased that awareness, and thank you for your excellent presentation. I just want to make people aware again of the possibility to post questions in the chat. I know that in the chat there was written as a comment, if you have any problems seeing the chat, please leave and re-enter the session. That's not helpful to those that can't see it. So just wanting to say that that was a suggestion that sort of the technical support has given to people that, yeah, you can, but we get some applause in the chat box, so people can use the chat. That's good. So if people have questions, please post them there. That brings us to our second panelist, Dr. Ngozi Ekeke. That's the wonderful thing about these things. We all travel to Nigeria now. He's a medical advisor at the German Leprosy and Tuberculosis Relief Association. That was the logo DAHW you saw at the beginning. And with your, please feel free to turn on your camera, Dr. Ngozi. You have with the experience of the support that you give to the national program in controlling various diseases, I'd be interested to hear where have you observed the relevance of WASH for NTD control during your work with DAHW in Nigeria. And since your camera, I don't see you on yet, are you there? Is your camera?
Yes, I am.
Okay.
I am. Can you hear me?
We hear you perfectly. If you can turn your camera on, do that. If it's not possible for some reason, it's important. We hear you. We see your presentation, so the floor is yours. Thank you.
Okay, thank you very much. If you can hear me, just to confirm, you can hear me once again, please.
We can hear you, and we also see you now, which is wonderful. So it's working.
Beautiful. Thank you very much.
The floor is yours.
Okay, greetings from Nigeria. For us in German Leprosy and Tuberculosis Relief Association, we are involved in supporting the national program, the government of Nigeria, in control of some neglected tropical diseases, leprosy, borreliosis, hepatic filariasis, and several others. Can I just get my slides on? Stand for me. Fine. We actually work in areas with limited access to safe water, places with poor hygiene and all of that, where borreliosis and others are transmitted due to activities of people. Go ahead. Next slide, please. Can I get the next slide, please?
Yes, I think there's a slight delay in how the slides are flipped technically. So if you just continue to speak, that will be fine. The slide will then come.
Okay, beautiful. One of the very important things that we need to know here is that in leprosy control, for example, it is a very important practice that regularly the patient should actually soak their feet in water, wash, clean, dress up the wounds, lubricate with oil, probably exercise. This practice of wash is very important to prevent disabilities. If disabilities are not prevented, very likely problems would happen, including mental health challenges, which is actually increasing at the moment. And wash practices for these patients go a long way to help us in that. Again, within the places we work, we are also involved, even in school health programs, where we go to communities and we go to early case finding of some neglected tropical diseases, teach the children on how to find the cases early enough, what to do to prevent and control all of leprosy, borreliosis, scabies, and all of that. But we also have a challenge that in these same schools, there is no provision for safe drinking water. Hand washing is a problem. Open defecation is there. So soil-transmitted helminths and all of that is actually a big problem. So affecting the control of neglected tropical diseases. You can go on, let me see the other slides. One of the other things that is important for us to note here is that we had a collaboration with the American Leprosy Mission to pilot WASH in one little community. And in the community, we had to engage patients who had leprosy, borreliose, lymphatic filariasis, and other conditions. And they were taught how to soak their wounds in water, wash, clean, rub, and all of that. And after a period of 6 months, we had a very interesting result that quality of life for those who participated increased significantly by practicing WASH. And then their median disability score reduced significantly as well. So please go on. So within this community as well, some of the things that we had found would include the interesting findings that asking community members their opinions, what they think about what causes neglected tropical disease. Most of them would say, we think it is lack of safe drinking water, washing with dirty water, and all of that. And when we turned around again to ask them, over 350 community members, what do you think we can do to control neglected tropical diseases? Most of them said, look, if we provide safe drinking water, that will go a long way to help us. So trying to conclude now, we think that looking at the challenges we have, that when we go to schools, we don't have the aspect of the WASH where water is provided, hygiene education provided, there are no good toilets and all of that. So it's difficult to actually achieve a control of neglected tropical diseases overall. But within the little place we piloted, we now observe that it is very, very important for all the NTD actors and the WASH actors to come together to collaboration. So I will stop here, and perhaps when the questions come, I can speak further on the topic. Thank you very much.
Thank you very much. I'm sure we'll get more applause in the chat in a second. Thank you very much for that wonderful presentation and showing us simple WASH measures that can lead to preventing and controlling NTDs and disabilities. Thank you very much for that input, Dr. Ngozi Ekeke. We will go to our third speaker now. This takes us to Ethiopia. We have as a speaker Mr. Ghion Shumetie, coordinator of the Amhara, that's a region of Ethiopia, trachoma control program, working with the organization of ORDA, and a project partner of Christian Blind Mission. And we hope you can turn on your camera for us so we can see you, and that we can hear you if you're unmuted. And we'd be very interested to hear from you. What does the link between WASH and NTDs from your perspective look like at a community level? So we're looking for a community level perspective from you, and looking forward to hearing from you.
Thank you, Tilo. So as you mentioned, I am from organization and rehabilitation in Amhara, ORDA in Ethiopia. So just ORDA has nearly 25 years experience in WASH. And because of this work, and then since 2010, we are just start to implement WASH NTD projects into districts, and after that we just expand with our partners, CVM partners, and then we tried to cover much more districts or peoples to reach. And then since then we are working on WASH NTD, particularly with trachoma. So when we implement this WASH NTD, we are using the SAFE strategy, and our focus is the FND part from the SAFE strategy, and then we are focusing on the root causes just to prevent or to eliminate trachoma. So in the first place, we are working with the community. So from approaches that we follow, community and stakeholder engagement and collaboration and coordination is our approaches. And we're just discussing about the issue, the WASH problem in the NTD, using ICBC materials and having discussions with the community and the religious leaders. And then we try to convince them, and then we just try to implement our projects with the community. And when we talk about the relevance of inclusive WASH in the course of NTD, in the first place, it's good to know what is the root cause of trachoma in our context. So among the root causes of trachoma, low level of awareness is the one, which is very low awarenesses in the community, and poor hygiene and sanitation is the one, the root cause for trachoma, lack of water access just to prevent trachoma, and poverty and crowding also the root causes of trachoma. So when take into consideration these issues, relevance of WASH and NTD in the course of NTD works is very crucial. So WASH and NTD, just to prevent the NTD, this is very important and very indispensable role. So when we see the FND components, just we focused on constructing water pointers and educating and promoting hygiene to the community. So I think it's good to proceed to, yeah. So using this hygiene promotion, we just create the demand of the community, and then after demand creation, they request access to water for the facial cleanness and environmental management. So for this, as you see from the slide, we in all project intervention, we are considering the inclusive designs for the water pointers and the VIP latrines at the community and at the institution level. So we try to address or accessing waters for the community that we are creating the demand of WASH. Next slide. So accessing water, next slide please. After accessing the water pointers, it's not enough to trace or to prevent the trachoma. So having private latrines at the community level is very important, because if there is no latrines or proper management of wastes in the community, the fly is there, so the fly is there, and the fly is the means to transmit trachoma. So we are just working on hygiene promotion to people to have private latrines and then hygienic and good management of the water points when they are fetching. So from this, we discuss with the community from the construction, from the planning up to the construction time, and then just we supply these water systems, and then we are assisting using our social workers to have private latrines. So this is what we are working in the community, and the other is at school levels. You know, school children in our case are very critical mass just to for trachoma. As you know, trachoma is affecting children from 1 to 9 years. So in our case, in our region case, nearly 4.5 million children at the primary school level are at school. So when we engage in the school trachoma clubs, and if we are working at school, just we are getting the critical mass for trachoma. So at school we are organizing clubs. We trained the school clubs, and then these school clubs also managing their schools, teach their colleagues at the school, and then we also link with the community what they learn from the school, and then how to teach their family and the like. So this is the way we are following at the school. So I think the time is gone. Thank you. This is all about the issue.
Thank you very, very much, Mr. Ghion Shumetie, for that presentation. Yes, you're right. We do have to keep moving with the time, but thank you for your great presentation, and there is the opportunity for people to now pose questions. So I'm sure our discussion will continue. At this point, I do want to make you all aware if there are any questions of understanding, further information you would like, do pose your questions to the chat box. I think a few have been posted already, and at this point I'll hand over to Jan Thilo Klimisch from Christian Blind Mission. There are not many Thilos out there, but there are two of them on this call, and we get to hand over to each other when it comes to questions. So yeah, happy to hear from you which questions you would like to pose from what has been posted in the chat.
Thank you very much. Hello, everybody. Yes, indeed, there has already been quite some activity in the chat box. So lots of applause indeed, and lots of positive comments on the 4 inputs we've heard until now, also some first comments. So there's been a first comment, I think, addressed to Constanze and her input on the One Health approach. So Johannes Rück from the German WASH Network commented that this should also include the economic dimensions, food hygiene, food supply chains, wet markets. Perhaps something you want to comment on then, Constanze. Then there's been a question to Dr. Solomon from WHO for some precision concerning the snake bites, and the question was, when you regard the management of snake bites, is there really rather a focus on prevention or treatment, or is it both? And we have a question also to Dr. Ngozi that was here from Arno Kerber. Yeah, here we go. What precautions and arrangements are needed for leprosy patients to use public wash facilities safely and inclusively? And now I see directly also a question to our 4th panelist. So we have one to each, and we can have then start into a first or a second round. That's to Ghion. The question is, can you describe the importance of women in the WASH communities? What is their crucial role, and are they trained to maintain and repair these water points? So yeah, I think I give back to the panelists and ask you to comment on these first questions.
Perfect.
Please go on with further questions, and I will then. I think we can then have a second round.
Thank you, Jan Thilo, for that. I think I would call on the people in the same order that you just posed the question to them. So we'll begin with Constanze, if you want to unmute yourself and turn on the camera, and just to the panelists, if we have short answers that are precise, we can actually take more questions. So that would be my encouragement to you. Constanze, over to you. Constanze, are you there?
Constanze left the room. Maybe we can start with Anthony then. Okay,
thank you. So Anthony, over to you.
Thank you, Thilo, and thank you for the question. It's about whether the focus in snakebite endemic is on prevention or treatment. The answer is both. Treatment is complex because it's a complex medical intervention to care for people with snakebite from multiple species and who often require full organ support. From a WASH perspective, a key intervention is making sure that people have adequate water and sanitation close to their homes that's safe and accessible, so that they're not having to go to use the bush or the field to defecate, and therefore expose themselves to greater risk.
Thank you so much. Very clear and a snappy answer. Over to Dr. Ngozi Ekeke. Are you there? Can you unmute yourself?
Okay, yes. Can you hear me, please?
Yes, we hear you. And if you can turn on your camera, we can see you as well. That would be great.
All right. I'll try to do that right away. Okay, while my camera comes on, I want to thank Anno Koeva for that beautiful question on what precautions and arrangements are needed for leprosy patients to use public wash facilities safely and inclusively. First of all, I want to appreciate the fact that in Nigeria, the government of Nigeria recently had passed the Disability Act, which promotes the inclusion of persons with disabilities generally. And using public wash facilities is not a problem for leprosy patients or persons affected by leprosy, unless they have disabilities that may not enable them to do so. But then those who have, for instance, open wounds and all of that, they wash, like soaking their feet in water, washing, lubricating, and doing all of that to prevent disability is actually done at home. And also once in a while in the health facility for new patients while they are guided. You know, so this is the arrangement. They do most of the things at home, but if a patient needs to use a public health facility, yes, the person can use it. And, you know, but one other thing that's important to note here is that people, there is no infection, there's no risk of infection once a patient has started leprosy treatment. So the person can freely use any public wash facility at no risk to the general public. So it is not a problem regarding safety. And though we know we'll have a few issues with the social exclusion about leprosy patient stigma, not only leprosy patients, but persons with disability. So the challenge of having using wash facilities by persons affected by leprosy or persons with disability is a big issue. But then to answer the question, there is no risk at that. The measures are that people accept them and they are supported to do that. Of course, they are on treatment and they are at no risk to the public. In fact, if anything, we want to encourage them, we want to accept them, we want to make sure that the society, and that's what we've been doing, you know, in all the activities, trying to make the society accept these persons. And so that is what I may have to say. I don't know if there are other questions. Let me also take them on.
Perfect. Thank you very much. I know Constanze has come back in the room. There was a comment posed to you by Johannes Rück in the chat box. I don't know whether you had time to prepare because I don't know when you left. I'll pick on you in a second after we go to Mr. Ghion Shumetie for his intervention. So Mr. Ngozi Ekeke, if you want to turn your camera off, or maybe you're doing that already, and Mr. Ghion, you turn yours on. Floor is yours.
Okay. Thank you, Tilo. There are two questions with me. The one is what is the role of women in WASH committee? And the second question is about the religious leaders and about safe disposal. So with the first question, the role of women in WASH is high because in our case, women are very responsible to fetch water and for home management. So they are very essential when they are get involved in WASH committee because they know the problem of water, being they are responsible to fetch water, to access water for their family. So their role is very crucial, and then we engage by giving training for them with others. And mostly their role is in village hygiene educator. They are educating about hygiene promotion by rounding house to house, and then in most cases they are engaging in village hygiene educator in hygiene promotions, and then they also engage in WASHCO committee like a secretary or accountant. But in the maintenance part, it needs somehow, you know, some energy to maintain water points. So mostly it goes to the main. So this is the way we are participating the women. The second question is the role of religious leaders. Can I proceed or stop here, Thilo?
I'm muted. If you have a very short answer and you immediately want to take that, but I'd welcome it in just 1 or 2 sentences, because then we would, I'd like to get a second round, otherwise that will be short.
Okay, yeah, in our case, the religious leaders are very dominant and accepted by the community, so they teach their followers about how they manage their wastes, because there is in the Bible that just to manage their pests, not to affect others. So in short, the religious leaders, both Christians and Muslims, are very accepted by the community, and we are using them just to convince the community. Thank you.
Perfect. In this case, back to Constanze. I hope you are here. I hope you can hear us and that we can see you. Floor is yours.
Yes, I can hear you. I can see you. I hope you can see me and hear me, because I had answered the question and I was hoping you had heard me, but maybe
no, but we can see and hear you now, so please.
Perfect. Yes. Now, yes, and thank you very much, Johannes, for this comment. Very important. The economic dimension should be and is included in the One Health framework, especially when it comes to NTDs, which are poverty related. Many infections could be or can be prevented by increasing livelihood opportunities, income, and by doing so, sanitation and hygiene and access to higher quality food and other alternative income sources other than those that are so close to animals and in general better hygiene situations. So yes, very much so. And it is included in the One Health framework, and that's the beauty of this framework, that it is a very inclusive one that makes the interlinkages between the different sectors and disciplines, including the social science and economy.
Great, Constanze, very concise answer, thank you. I hand over to Jan Thilo Klimisch one more time. I think we have 5 minutes, so if you can pose questions, I don't know if perhaps it's a round of rapid fire, or maybe there's one question. I don't think we can take extensive questions to each, so over to you for, I guess maybe it is a short answer, 4 minutes.
Yeah, well, we have one more question here dedicated kind of to all panelists, so perhaps we can have really a rapid round, a rapid final round. And the question is, how is the One Health perspective appropriate for post-pandemic recovery and resilience? And perhaps you can just very shortly combine your answers. Also, perhaps we heard a lot about what is in favor for implementing these cross-sectoral, multi-sectoral approaches. Perhaps you just can briefly comment on what are till now still major obstacles, or what would you be, on the other hand, your political recommendations, as then we will hear some final political remarks from the ministry. Thank you.
That's great. Maybe from those things you've asked, each of the panelists can think about sort of one concise thing to answer in terms of sort of 2 sentences, and I will be quite strict this time on sort of time. Constanze, do you want to begin?
Yes, maybe the question on how One Health approach or concepts can also help in post-pandemic and recovery and resilience. Well, as it is an approach that's appropriate to improve health outcomes in general, it is it has impact in a preventive way and in a curative way and in a recovery way. After a pandemic is sadly, I presume, before the next one. So different intervention points need to come in and together there as well after the pandemic. To rebuild resilience or to rebuild and to increase the resilience. And there's again the economic dimension as we had heard, spoken about just now. Human health preparedness needs to be there and increased possibly. The interconnectedness that I highlighted in the beginning needs to be acknowledged, and preventive measures and put in place. They are in collaboration generally improved on the different levels, national level, between the research institutions and implementing agencies. WASH needs to be there and improved. So the different interventions that need to be there for curative measures, also need to be there for resilience building and recovery after a pandemic.
Thank you, Constanze. Dr. Ngozi Ekeke. Dr. Ngozi, can you hear me?
Yes, I can hear you.
Yes, maybe just a very short statement from you.
Yes, thank you very much. To that question, how is it appropriate for a post-pandemic recovery and resilience? Great collaboration between One Health, WASH, and NTD actors is very, very important at this point. You remember that for instance, in Nigeria, we have poverty is there. There's already economic challenges. And hygiene is also a problem. So with good collaboration and coordination, we'll be able to reduce diseases both in the animal and human lives, and then improve economy, because many persons will have to depend on this as well, both economy and well-being, and reduce a lot of disabilities. So collaboration is one way to go, and it has a lot of benefits because it's going to improve economy, it's going to improve WASH, it's going to reduce disabilities, it's going to bring down the neglected tropical diseases. Collaboration, coordination is the key, in my opinion. Thank you.
Thank you. Very clear statement. Ghion Shumetie.
Thank you. One Health is not only post pandemic and resilience, but it's always very important. One of our problems is just implementing separately by different actors is very challenging. But when we come to in One Health, our resources come together and we can coordinate and collaborate together, then it's very important, and we can play a significant role to bring the health changes in the community and in the country level. So it's always very important, just not only post-pandemic and resilience, but it's always very important. Thank you.
Thank you very much. And Dr. Anthony Solomon, do you want to end? And as I will hand over in a second to Birgit Pickel from the German Federal Ministry, we also heard maybe something political to call upon, or what do you want to say? Final statement.
I just note, as Ghion has mentioned there, that this One Health approach has always been preferred, but perhaps because of the widespread disruption that's occurred to nearly all NTD programs as a consequence of COVID-19, as we build back, we have an opportunity to build it better than we used to do it. And the more we can get all stakeholders around the table to build back programs in an ideal way, the more progress we'll make in the future. Thank you very much, Tilo.
Thank you, and a big round of applause to all of our speakers and panelists for this session today. And it's my pleasure now for the closing remarks, reflections of what we've heard, to hand over to Birgit Pickel. She is Deputy Director General at the German Federal Ministry of Economic Cooperation and Development, and the ministry has been reshaped. I think you'll perhaps say something to this. It's a pleasure to have you here in your new role in the ministry, for this discussion. Please, the floor is yours.
Thank you very much, Mr. Panzervita, and also I would like to thank the German Network Against the NTDs and the German WASH Network for organizing this important session and for enabling this intersectoral multidisciplinary exchange. I think this is what One Health is all about. And thanks to all the presenters for the good examples from different countries. It's always very good to get feedback from what's actually happening on the ground. Here in BMZ, we strongly believe that the holistic approach that all of you and particularly Ms. Bönig have asked for, and the intersectoral approach covering the complex relationships between the health dimensions of humans, animals, and their shared environment will lead to enormous public health benefits. So our focus is on prevention and on maintaining health by avoiding risks. Not solely, but as a focus. And this is, as we've just discussed, the fundamental idea of the One Health approach and a guiding principle for BMZ's action and programming. I mean, as you said earlier, Dr. Solomon just said it, it's not a new approach, but now we are really in the post-COVID situation, or in the COVID situation, in the position to put a strength and focus on this One Health approach and really make it happen and implement it. So my ministry, since the 1st of August, has indeed created a new directorate, which is called Global Health, Pandemic Prevention and One Health, and which also includes a distinct division on water, sanitation and hygiene to operationalize this approach. So this is the political statement of the ministry, that we really take this intersectoral approach seriously, and we want to make progress on this approach. Currently, as a ministry, we are indeed working on a new strategy on One Health. It's really trying to come to grips with the difficulties also of this, the challenges, the opportunities, but also the difficulties of this approach. In this policy document, we will outline our engagement in the upcoming years. And it builds on our experience in the fields of human health, pandemic prevention, WASH, agriculture and food security, but also the environment and biodiversity. So just naming all these sectors already shows the challenge that comes with operationalizing the approach. And we do hope that we can, with this new strategy and investment coming with that strategy, make some progress on operationalization. And we're happy to do so with different stakeholders nationally and internationally. Some of you are part of this meeting, but there are many others to consult and integrate into this approach as well. So COVID-19 is really more than a wake-up call, and it clearly shows us that the challenges can not only be tackled in the health system alone. I already said that we take COVID-19 as an opportunity to strengthen preventive measures within, but also outside the healthcare system. This approach, we believe, can not only reduce the probability of transmission of infectious diseases, and we've heard in the beginning sort of the importance of infectious diseases, the zoonotic issue, and so on. So this is really a focus of our work, but also the broader contribution of the One Health approach to reaching a range of other sustainable development goals, such as fighting hunger and protecting life on land and on water, access to water and sanitation for all. We've heard a lot on this particular sector, the WASH sector, which can contribute substantially, particularly in reaching out to the poorest of the poor, linking up to the NTDs, etc. I would like to acknowledge in this context the recently published Wash and Health discussion paper of the Sustainable Sanitation Alliance, SuSanA, which emphasizes the fundamental role of WASH for the health of humans, animals, and the healthy environment, and identifies entry points for both sectors to collaborate more closely in order to achieve sustainable health. I think the examples we've listened to today were really good examples to show us the opportunities, but also the challenges of this sector. We are very happy that the German WASH network and the German network against NTDs are joining forces to raise awareness on this crucial link between WASH and NTDs. And we were all hoping to be in Kigali this summer to look at the new NTD roadmap and support to it. Now, there has been a bit of a delay in this process due to COVID, but I think the postponement doesn't mean that the roadmap and the implementation of the roadmap do not remain important, and we as a German government certainly remain committed to making our contribution to this important piece of paper. Let me finish with these few words, again thanking all the presenters for their inputs. Let me stress again that really in our COVID-19 immediate response, some of you might have heard that we as a ministry have really come up with a quite substantive package as an immediate response to COVID, with a total volume of sort of 3 billion additional euros in funding, but that is the immediate response. We are now moving into sort of the recovery and building back better scenario, and we do think that the One Health approach, which we are now adapting more seriously, I would say, and more intensely as a ministry, can make an important contribution to that building back better agenda. So I thank you very much for this fruitful and inspiring session today, and thanks again to the organizers.
And thank you to you, Birgit Pickel, for those closing remarks. And it's great to see that the German Federal Ministry has such a commitment to this topic, and we look forward to collaborating in the future. The paper you just mentioned by the Sustainable Sanitation Alliance, I just posted the link in the chat, and we also have a webinar that may be interesting to many. Do feel free to continue posting other useful links in the chat. That's always a good way for us all to stay in touch. I want to thank everyone for joining, everyone who participated in the preparation and carrying out of this event, and wish you all a wonderful day. Thank you very, very much.